Dr. Vikki Petersen here. The topic that I wanted to speak about today was prompted by a recent journal article from the American Journal of Gastroenterology just a couple of months ago, March 2nd, 2010. And they talked about a topic which was regarding children and constipation and an association with gluten and dairy as well. If you've ever experienced constipation as an adult or as a child, it's of course rather miserable experience, but beyond the discomfort, what it means is that toxins that the body should be expelling once or twice a day are not being excreted, and that autotoxicity or toxins staying around in the body too long has a lot of deleterious effects. So it's something that we definitely want to address. In my 20-plus years experience, I found exactly what this research article found, funnily enough, and that was that they definitely saw a correlation between gluten sensitivity and constipation. Specifically, they were looking at very young children and a window of 6 months, so that they found that children that were introduced to gluten at the 6-month mark or younger had a much higher incidence of constipation than those who were introduced later. And that 6-month mark is definitely something we've heard about before, even associated with celiac disease. So studies have shown that if children are not introduced to gluten prior to 6 months, they have a lowered risk of celiac disease than those who were introduced prior to that time period. And it's thought to be associated with the maturity of the immune system, and introducing too soon is very damaging to the immune system, and it's more likely to result in the more serious celiac disease. Now we know with celiac there is a genetic preponderance as well, but this time frame of the 6 months is definitely something that has come up many times before. And of course, with celiac disease, what we've talked about is that all too often as clinicians, we're taught that celiac has sort of a classic relationship with diarrhea, weight loss, and so children or adults that are more complaining of the constipation, slower bowel movements, would not be an instant jump to the traditional clinician thinking about gluten as being a problem. So this was a good study that really brought to light the fact that that correlation is most definitely there. They also mentioned that dairy intolerance was associated with constipation as well, which we have definitely seen in our patients. They did note that other foods like eggs and soy, tree nuts did not show that correlation when they were introduced, so it does seem to be something more associated with gluten and dairy. So this is an area that I wanted to bring to light because all too often I have found in my clinical experience that when parents come in with a constipated child, they're either told to give them a laxative or an enema, or they're told that it's normal, that it's absolutely fine that their child doesn't have a bowel movement except maybe once or twice a week. Believe it or not, it definitely raises my eyebrows when I hear that, but all too often parents, I find, are told that is absolutely normal. I disagree very strongly with that, and sure enough have found that when the root cause is discovered, the food sensitivity, that constipation rights itself, and the child is moving their bowels once or twice a day, which is normal. So I would encourage anyone who's having that problem, be it with a child or themselves as an adult, to assess whether gluten and or dairy is causing the problem. So I hope that helps, and until next time, I wish you very good health.